she just imagined this because I didn't have no rocks, but yeah, my meniscus has a slight tear, and could that be the cartilage that just degenerated because of the lupus, or I don't understand, because she says it has nothing to do with lupus.
You don't quite believe her.
I don't. But I just need another rheumatologist to help me to stay,
Well, I'm not really, examining it. I'm not really reviewing your record, so I can't say.
Right.
She has seen you. She has examined you. She may have some imaging data that may, Certainly, if you have inflammation in the joints for a long period of time, you could be left with damages, with deformities. I think what she meant to say is perhaps you somehow twisted it somehow. You might have stepped on a rock. You might have torn something in there. But
it didn't occur.
If it were due to lupus, perhaps you should have inflammation in there, or have you had long-time inflammation in the joint? It's not just gonna. You're not just gonna have a knee problem out of the blue.
Right. It didn't. This didn't occur until an hour later.
Hour what?
Hour later after my walk. It was a fast walk, but after my walk,
yeah, exactly.
I was just stretching, and all of a sudden my knee locked.
Exactly. It was after some event.
After the event.
Yeah. So yeah.
It wasn't during.
It doesn't have to be during.
Delayed reaction.
Yeah.
That happens to me sometimes.
Yeah.
I was walking.
Yeah. But you were still walking. If it was the lupus, it would have presented in a different way. There was a cause and a reaction.
So that's what you're saying, doctor?
I don't know. I don't know exactly what you're
That's what your doctor's saying. That you went on a walk and you therefore had the injury that resulted later from the walk.
You could have all kinds of knee problems. That goes back to one of my pet peeves. When my lupus patient would show up to the urgent care ER for any problems they may have, they blame everything on lupus.
I do too.
Everything's from lupus.
Right.
And I think one of the main problems that we as lupus patients have is that we generally don't do a lot of exercise, and we get to be to the point where we become very weak, and all of our bodies become weak. And I've had to go through many sessions of physical therapy and stretching and different things because it's very easy for us to become injured. And me with my walker, I've had to relearn how to do a lot of things, and it's very easy for us to injure ourselves doing very minimal tasks.
But I do strenuous activities. I make sure. When I was diagnosed with the lupus, I fought in the terms of suicidal. I was just making sure that I was, climbing hills, and I was making sure that I was doing everything because I have asthma as well. So to be able to strengthen my lungs as well.
You want to use them.
Yeah.
Right.
So I'm like, no,
that's me too.
No, I have to fight.
Right.
So I was wondering.
So that goes back to just because a lupus patient has some symptoms doesn't mean it's all lupus.
Yeah.
Right.
Lupus patients are just they're just patients. They're just people. Certain things could be associated with lupus. Certain things are hard to tell, but just because you have something doesn't mean it's due to lupus.
I think it becomes easy to blame everything on lupus because lupus has so many different symptoms. So I remember I'm probably one of the pet peeve patients you're talking about because I know that there's been times where I've just had a cold or a flu and I'm like, oh, it's the lupus. Or, my big toe hurts and I'm like, oh, it's the lupus. Whatever happens, I'm just, blame it on the lupus. Because lupus can manifest itself in everything, whether it be like a blurred vision or something wrong with your skin or your nails or your chest hurting or, like when I got my gallbladder removed, like everything I seriously just, I mean, how do you know it's not the lupus?
So gallbladder. A lot of women get their gallbladder out. More so, a little bit more so than men, especially during certain years. And so when a lupus patient has gallbladder problems, most of the time it's not lupus related. Could it occasionally be? Sure. Lupus could cause inflammation in the blood vessels. Lupus could cause, a lot of things. But because you have a gallbladder issue when you have lupus, doesn't mean it's from.
Why do so many women have gallbladder removed, you think?
Oh, you have gallstones.
But is that, you're saying women in general or women with lupus?
Well, a lot of my, no, women in general. So a lot of patients have their, and if there aren't, and certainly gallbladder problems is a lot more familial, a lot more hereditary than something like lupus. You could bet daughters of, certainly in overweight patients, daughters, even in thin patients, daughters who have moms who had their lupus out, most of the time they're going to have it out. Sometimes even a lot of times earlier. But that's not because of lupus.
Someone asked, can they use Remicade for lupus?
Remicade is an anti-TNF agent, and you sometimes could use it in patients who have both lupus and rheumatoid arthritis, what we call lupus.
Wow.
Lupus is pretty rare. I do have a few patients with that. And
That would be
typically, if
horrible.
the manifestation is just lupus, we don't use Remicade.
Okay.
And there are some reports showing that Remicade would actually increase the risk of lupus flare-up
Oh, wow.
if you just use Remicade when you only have lupus. So it's not approved for lupus. There's so many things that are unapproved for things that we use anyhow. What's really approved for lupus that's really helpful? I mean, over the past 50 years, been this stuff. So Remicade is completely different from that. The mechanism is different. And has it helped some patients with lupus? Sure, if the main problems are joint swelling and joint inflammation. But typically it's not a first, second, third line option.
Is it common or possible to have like both SLE and discoid lupus?
Yes,
I do.
it's common.
I do, yeah.
It's common. A lot of patients with lupus don't have discoid. Discoid is more of a chronic manifestation of lupus skin disease.
Right.
And you could have that. I do have patients with discoid lupus only, without systemic lupus, just discoid lupus. Could you have discoid lupus in the beginning and gradually evolve to having systemic lupus?
Yeah.
Sure. So that's also possible.
Because at first I was told I had morphia,
Yeah,
and then it was scleroderma, and then later, it was the lupus, and then discoid lupus, because the lesions and stuff.
Well, the morphia is a little different. Morphia is more limited scleroderma.
Yeah,
And in your case, that's a little interesting.
yeah.
So all those things could occur, and stranger things have happened. But so we have to keep an open attitude. You have to keep it. Everybody presents differently. Every person is an individual, and I have some patients with very, very mild lupus, and a lot of patients, different degrees of it. But overwhelming complaint is fatigue. But then again, just because they're positive ANA and fatigue, does that mean you have lupus? No, because so many people have fatigue. One of the later stages of complication of lupus, if you had it for a long time, if your cholesterol, high blood pressure is not under control, it's heart disease. Heart disease.
Now, what do you recommend to your patients who are anemic when they've managed, because for example, I'm severely anemic. I don't eat any red meat.
You could eat turkey. Turkey's got iron.
Yeah, and that's basically what we do. We eat turkey.
Dark green leafy vegetables.
And my stomach doesn't digest leafy vegetables. I basically I regurgitate any leafy vegetables that I eat. They've done stomach emptying tests on me, and nothing. The results are normal on the stomach emptying tests. but I don't digest it. They just did the iron testing on me this week, and
Slow.
they said that I'm 3%.
3%.
Mm-hmm. And it's like 9 point something on my.
So if your iron is only 3%, and if it's difficult for you to take certain things, and in your case, when it's 3%, that's pretty darn low. You may want to consider getting iron infusion.
Yeah, it actually was the sleep specialist that ran the blood work for me, because I have near insomnia. They diagnosed me with a circadian sleep disorder, and so basically I get mainly, like, off and on. We were estimating like 11 hours of sleep, but it's like broken up sleep, and
You're not getting into the deep sleep. Yeah.
no. And it's just, I toss and turn, and it's
Okay.
like whenever I do sleep, it's interrupted, and it's mainly because I'm in pain. Any noise, anything wakes me up, and I don't typically go to sleep until after 1 o'clock, 2 o'clock in the morning, and then I wake up at 11 o'clock, noon. And then now that I'm actually on sleep medication, I take melatonin and sleep medication, and then she has me using these blue blocker glasses. I like put them on at like 9 o'clock, 10 o'clock at night, so that I can start getting sleepy.
So it makes your brain think that night already, you should go to bed.
Yeah, it filters the blue light out, so that when I watch television, my brain starts getting sleepy. So I've been typically going to sleep at like 11 o'clock, midnight, but I have to take the medication to be able to stay asleep, and I've been waking up at like 10, 11 o'clock in the morning, but I have to take that medication, otherwise it's the same thing. I'm up until 2 o'clock, 3 o'clock.
So, I mean, some patients with iron deficiency will have some issues with sleep as well. So perhaps when that's corrected a little better, maybe you can sleep better. Sleep is a big problem in this country.
Yeah.
Across all sectors. People don't get enough sleep. People don't get enough good sleep. And especially affects patients with autoimmune disease as well. But anybody could have sleep problems, and it should be addressed.
So we shouldn't blame that on the lupus either.
Well, no, sometimes when,
Yeah, sometimes it can
for
be.
example, lupus patients have more fibromyalgia than the average population. The fibromyalgia is only about 5 to 7% at the most, probably.
Can you answer what is the difference between fibromyalgia and lupus? Because someone on here also asked that.
So fibromyalgia is a condition where you're hurting all the time, all over, every day. You can't sleep well. You may have irritable bowel problems. You may have migraines. And
irritable bowel syndrome from my fibromyalgia.
irritable bowel is commonly associated with fibromyalgia. It's not from fibromyalgia.
Oh.
You don't have to have irritable bowel to have fibromyalgia. And for years and years, a lot of physicians would just kind of ignore fibromyalgia. And it's a real thing. And there's some new studies have shown that in fibromyalgia patients, small nerve fibers are actually affected. So now there's some sort of disease basis for it now. So that's fibromyalgia. It occurs in about 2 to 8% of the population, depending on which studies you look at. And it's more common, women to men, about 9 to 10 to 1.
Now, are the joints also affecting fibromyalgia?
You could have joint pain anywhere. You could have bone pain anywhere in fibromyalgia. So that's fibromyalgia. You get fatigued, you're tired, you could have brain fog, you could have any of those things. You could be depressed, you could be anxious.
How do you get diagnosed with?
Yeah, I want to ask that question too. How do you get diagnosed with fibromyalgia? How do you see
Any
it?
doctor, anybody could diagnose fibromyalgia. It doesn't have to be a rheumatologist. However, I get those referrals too.
Can you ask that question again?
So that's fibromyalgia, and so we're talking about primary fibromyalgia. That's what you
I
have.
don't know what that's
There's secondary fibromyalgia, patients with chronic illnesses, patients with traumatic problems, after a car accident, after any sort of traumatic events. Patient with lupus, patient with, are more likely to get fibromyalgia. And
So is it done by a test or clinically done?
it's a clinical diagnosis. And if you have primary fibromyalgia, your test should be negative. And you could have secondary due to rheumatoid, due to lupus, due to anything. Secondary fibromyalgia.
Yeah, it used to be that they had the trigger, right? The trigger points or the tender point.
Tender points we still use. If you have no tender points whatsoever, you don't have fibromyalgia. You have to have a good amount
Can
of
you
it.
explain what the tender points are?
So tender points are in certain spots of the body, going from the neck, upper neck, going down to the shoulder blades, going down to the lower back, and that's in the back and around the hips. In the front, you could have it in the anterior chest. You could have it around the neck area. You could have it in the legs. You should have it upper and lower to have fibromyalgia. Some people have 3-4 spots. That's not fibromyalgia. It's got to be enough spots. You got to have it on a regular basis, and it could be very disabling as well.
And I'll tell you, the slightest touch in those spaces can make you want to jump through. Every time my doctor has to push on those areas, it brings me to tears because it just
And you hurt for
hurts.
several days afterwards.
It hurts so bad. By the time I leave, all of those areas are just in knots. from the
Even
exam.
sometimes just a simple hug is painful. Like I'm like, don't touch me.
That's
Yes,
fibromyalgia.
yeah.
Simple hug is painful. You avoid intimacy. You don't want people to touch you. If you happen to get a massage,
Wow.
they need to just touch you very lightly.
Yeah.
Any sort of deep tissue.
I
is
avoid
not-
massages.
Yeah.
I can't do. I mean, I can have them done, but the next day I messed up.
So that kind of goes
Get no massage.
leads to where patients have fibromyalgia pain. Let's say some patients just have really bad ache somewhere, and they actually like people that work on it hard. That's not fibromyalgia. Yeah, that's just that's just muscle spasm. That's just
Does anybody who hasn't asked maybe have a question
I just have one question. Do you have any suggestions for Raynaud's? Because my Raynaud's will hit me at any given time, and it's painful. Yeah, it's very painful, and it's my toes, my fingertips, my nose, my ear tips, and it hurts.
Have you ever had problems with sores, actually developing skin ulcers due to it, or not
No.
quite? Okay, so Raynaud's is one of those things where it's commonly associated with lupus. It's very commonly associated with scleroderma. Anybody could have it even without anything. They just have Raynaud's. Some people just have Raynaud's without any underlying diagnosis. Some people have Raynaud's first for a few years, and later on they get diagnosed with something else associated with it. So that's what Raynaud's is. Raynaud's is a vasospasm, which is the spasm of the small blood vessels. So you can see there's small blood vessels going to the nose tips too. That's why you have problems there sometimes. Sometimes it's the ears, sometimes it's the hands, the feet, and if it's mild, let's say you get the purplish, you get the whitish discoloration, and then it returns pretty quickly when you get warm. Dress warmer. Your core body temperature when it's too cold, when it's too low for you, you get Raynaud's attacks. If you have stressful events, you get Raynaud's attacks. If it's mild, if the symptoms improve pretty easily, then there's certain medications you could take. Plaquenil helps us sometimes. There's some blood pressure medications, calcium channel blockers, ACE inhibitors. All those things could help with Raynaud's. Some cream could help it. Nitroglycerin cream could help with Raynaud's, and wearing gloves could help it. If it's more severe, sometimes people need to have sympathetic blocks to block the sympathetic system in the nerve system. And if you get to the point that you try and feel everything, and you have actually a lot of ulceration in your skin, and let's say sometimes it gets all getting pretty close to getting necrotic. Sometimes you just don't, when you don't have blood circulation for several hours, then it really gets out of control. You could do something what we call the Revadio, which is the active ingredient in Viagra. That may also help improve the circulation.
Now, what do you think about, because I've had Botox injections in one hand for the Raynaud's, and it's, the left hand is better than the right hand. Is that something that?
It's possible, perhaps they didn't get to the right spots
Yeah.
in the right hand. Perhaps your right hand is not responding. You could also try sympathetic block. They go up here a little bit more. Pain management doctors could do that. That may help as well. If it's your right side now. If your left side's improved, fine. If it's your right side that's bothering you, you can have sympathetic block. Eventually it could help you.
So does it get better over time, or it gets worse?
It varies. For some people, they always have it, just comes and goes. For some people, it can improve. It's not fun when you have it. You always have to dress a little warmer. In the summer too, even in the summer, you're in an air-conditioned environment. That's when the AC hits. That's when it really starts bothering you. So you want to be dressed a little warmer. Wear gloves. Keeping the core temperature up is very important in Raynaud's. Some people think, oh, I'm just keeping my hands warm. If your body doesn't feel warm enough, it sends off signals to cause the
I didn't know that.
spasm in the peripheral small vessels.
Have you heard of myocarditis?
Myocarditis.
Okay, so he's asking about myocarditis and troponin of 2. Troponin of 2.9. Does that mean that he has lupus?
No.
Okay.
No. Myocarditis is the inflammation of the heart muscle. Could you have it with lupus? Sure. Could you, just because you have it, you gotta find out what causes. Is it some sort of viral cause? Is it some sort of other inflammation? Is it just because you have it? It's not specific to lupus.
Someone asked if they have brain fog and concentration issues. What would you suggest for remedies for that?
The brain fog is a big complaint. Okay. First of all, you gotta make sure the sleep is good.
Yeah.
Improving the sleep could go a long way in helping with brain fog. I have patients who tell me I sleep 12 hours a day, but I still have brain fog. I'm sleeping a lot. I'm sleeping well.
Right.
Is it 12 hours good sleep architecture? Is it the 12 hours good restorative sleep? Is it the sleep that helps you unwind? Sleep is very important. Sleep heals a lot of things. Difficulty concentration. I would first improve the sleep first.
Okay.
And after that, you worry about, you may need some therapy. You may want to get a neuropsych evaluation to see what the deficits are.
How do you do that, though? I asked my doctor to give me a referral for a
neuropsychologist. So these neuropsychologists they're psychologists that that could assess your brain to see which part of your brain function is lacking.
Okay.
What is your take on Benlysta?
I take Benlysta.
I do too. I mean, for me, it's been a lifesaver. I've been on it for like a year, and my flares have gone from like 90% to 30%.
That's good.
You know,
That's
so
good.
for me, it's working great. You know, but I also take prednisone, Plaquenil, and Celsep along with it. But I mean.
But before the Benlysta, you were taking those too, but it wasn't helping as much.
Right.
So Benlysta studies were done on patients who did not have severe kidney disease
Right.
and who did not have severe lupus, more of a moderate type of lupus. And it's helpful. They're also studying other medications now. Some of them are similar to some of the rheumatoid treatments. And my take on Benlysta is that if it helps you, the side effects are usually minimal. Usually.
Yeah.
And if it helps you, it helps you. Then
Yeah, I haven't had any bad. I mean, the day of the infusion, I'm really tired. I could like sleep after, but other than that, you know,
So Benlysta is one of those things that's the first thing, that's the only one thing that was approved for lupus in the past 50 years, anything new. Anything other than steroids, anything other than Paquinel.
right.
So that's Benlysta. It helps some patients.
Yeah, they pre-med. They give me the 2 Tylenol and the Benadryl. It's probably what's making
That's what
me get.
Benadryl was making
I
me
don't take
tired.
the Benadryl with mine because it makes me so sleepy. I can't drive.
Oh, really? So maybe my next infusion, I'll be like,
Yeah, you know, I mean,
It makes me.
I don't take
You don't always have to take Benadryl.
yeah.
oh.
Yeah. So maybe that's
I
what's
didn't know
making
that.
you
I thought it
sleepy.
was just a necessity when you have that.
Benadryl helps you prevent infusion reaction, but not
Right.
everybody needs it. Yeah. Benlysta doesn't help everyone, but it can help a good percentage of patients when it's needed. Yeah. Has Benlysta helped you with your Raynaud's symptoms?
No. It's helped with the, the lupus part of it, but the Raynaud's, no. But I use, the nitrobid ointment
Yeah.
on my fingers, and I've had the Botox in my left hand.
Yeah.
So, but I haven't had it done in the right hand yet, so I'm sure it may help.
It may help, and then if it doesn't help, think about sympathetic block. That may also help you.
Yeah.
It's just an injection. All those things are good. Yeah.
Anybody else have any more questions?
Do you recommend that you see a rheumatologist that specializes in lupus? Because
Well, all lupus patients should be seen by a rheumatologist.
Right.
As far as I know, most rheumatologists treat lupus. So, unless you have one or two, there's an occasional rheumatologist that limit their practice to one thing or another. If you feel there are certain needs that aren't addressed, maybe you can get another opinion. Not everybody gets along with everybody, and not everybody, and sometimes some rheumatologists that say they only want to try to treat rheumatoid. Because rheumatoid, there's a lot of things, a lot of times patients do improve quite a bit. So that's my take on things. If you don't feel your specialist is not meeting your needs, then go to somebody else. Maybe get an opinion first. See, perhaps that's just the way it is, or perhaps there's more. Perhaps more could be done. Right?
Yeah, she doesn't speak much about the lupus. She just takes
Blood test
and prescribe.
and say that you're fine.
Right.
We need a new rheumatologist.
Well, I mean, I don't know. I can't speak for her. But,
Right.
Certain things. Sometimes patients have very bad, horrific events with the lupus, and really after they recover from that, the lupus is actually not that bad. It just you're left with some of the issues with it. So it's hard to say. And let's say the blood test, what did they really check? Did they check everything that could be checked? We don't know.
Any more questions? All right. Well, we can wrap it up, and if you guys want to get Dr. Howe's information after this, you can. And at this